So as you start to gather, it's my honor to introduce our next presenter, Dr. Brian Carlsen, and very honored to have him here. Dr. Brian Carlsen is a father of 4, a surgeon, and an athlete, and he was diagnosed with type 1 diabetes as a third-year medical student, when he was able to continue to pursue his life goals, a career in surgery. And he specializes in hand surgery and upper and lower limb reconstruction at Mayo Clinic here in Rochester. And in 2014, he discovered a whole food plant-based diet, and he never looked back. So he's got a remarkable story, and I'm just going to turn the mic over. I should say the little Britney Spears mic, right. Over to you. So thank you.
Thank you very much. Okay. So there are 2 types of diabetes, type 1 and type 2. In type 1 diabetes, it's an autoimmune disease where your immune system attacks your pancreas, specifically the islet cells of the pancreas, so that you no longer can make insulin or make insulin at extremely low doses. In type 2 diabetes, it's a disease of insulin resistance. So you can see in this picture, the insulin is the triangle, and there's very little insulin made by the pancreas. In this cartoon, a lot of insulin, but it's the receptor on the cells, so mostly in the liver and muscle cells that aren't working. And you can see in both conditions, there's a lot of glucose in the blood, so hyperglycemia. So they have that common pathway of hyperglycemia. And with that, you get a common kind of set of problems, and it's the hyperglycemia that leads to the same common diseases that you see in both conditions. So peripheral vascular disease, heart disease, kidney disease, all the vascular diseases. Type 1 is, like I said, an autoimmune disease, and it's incurable. Type 2 is a lifestyle disease, and the fundamental problem is insulin resistance. With time, the pancreas can, quote-unquote, get burned out and make less insulin. And so in type 2 diabetes, you can also need insulin. Interestingly, only 5% of diabetes in this country is type 1. The vast majority is type 2 diabetes. This used to be called juvenile onset diabetes, the most common diagnosed diabetes under 40, although this is changing as more children are getting type 2 diabetes as a result of our lifestyle. This is treated with insulin, a lot of different insulins, but treated by insulin only in terms of blood sugar management, whereas this is diet, exercise, pills, and then sometimes insulin. Any questions about diabetes? Yeah. Yeah, type 1.5. So it does get, there's type 1 and 1.5, 2, 3. 3 is like secondary, you had your pancreas removed, or cancer, pancreatitis it's not working. Type 1.5, I think is also called maturity onset diabetes of the young. It's basically this is my understanding, and I'm not an endocrinologist, but my understanding is an autoimmune disease, but it's kind of a less severe form of it. They have more pancreas function than the standard type 1 diabetics do, but other than that, it's treated with insulin and managed in the same way type 1 diabetes is. It's not that common. Any other questions? So when I was 25 years old, I was in medical school and got the classic symptoms of hyperglycemia. So a lot of thirst, fatigue, severe fatigue, and urinating a lot, dehydration, and lost weight. So it wasn't a long course of symptoms before I figured it out. I was working at in the pediatric emergency room, and I went and actually stole a dipstick and went to the bathroom, and my urine was full of glucose. I came out and told my attending like, you need to go right next door to the adult ER. So I did that. And one of the things that the doctor there told me was that, one of the first things he said is, I hope you don't want to be a surgeon. And of course, that is what I was intending to do. Fortunately, there was a resident in the program of a medical school who was a type 1 diabetic, and so I quickly learned about her and learned that that's not true. I can do that. So I started on injections and then went to a pump, which I stayed on through for many years, but have been off of a pump now for 10 years. Still on insulin, but off of a pump. I'm back to injections. The focus at that time was on normal glycemia and the American Diabetes Association diet, which is still to this day, and still what many people are told to do, is a low carb, higher fat and protein diet, which I'm here to give you some counter evidence for today and a different perspective on that. I had no family history of autoimmune disease or heart disease, so this really came out of nowhere. And that's pretty typical also for type 1s. They often don't have a family history, whereas type 2, it's very, very much more genetic. I went on to do a general surgery residency and then plastic surgery residency. Some people call it a fellowship. 2 years after my general surgery, that was all at UCLA, and then I came to Mayo Clinic for my hand fellowship. I was on a military scholarship, and then when I got type 1, they kicked me out. So that's just the way it is. So from age 25 to 42, I was just living, I would say, a normal life. I was very much career-focused, career-driven. I had 2 kids in residency, and then we had 2 kids in the first, in my hand fellowship year, and then my first year practice. I thought I was eating a healthy version of the standard American diet. I wouldn't drink whole milk. I'd drink skim milk. I'd throw away the yolks but eat the whites. I'd Raisin Bran for breakfast with milk and yogurt and toast. Thought I was doing it all right. And then veggie burger instead of a cheeseburger, but the veggie burger, if you look at it, has egg and other stuff in it. And then I would put cheese and I'd put Thousand Island dressing on it. That was called a Carlsen burger in the surgeon's lounge. People, I'd get a little bit of audience because I'd toast the bread and make it look good. But and then a chicken burrito instead of a steak burrito, and that was my idea of a healthy diet, which I think is similar to what most Americans would think. During that time, I was able to have a normal A1C, no complications. Again, on insulin pump most of the time. Like all type 1 diabetics, and you're never going to be as smart as a pancreas, so you're still going to have fluctuations. There are things that you can't say, oh, I feel a little bit stressed, I should give insulin. That's not going to work, because you're going to be wrong sometimes about that move. So as smart as you are, you're never going to be as smart as a human pancreas, and you're going to have some roller coasters. But in retrospect, some of these hyperglycemias, which I paid very close attention to this, I have an understanding in retrospect now. My primary exercise was basketball as a lifetime athlete, and this was my main sport I played in college. I would run, go for jogs because it was efficient, but basically 1 to 3 times a week. My endocrinologist and my primary care doctor were very happy, and I thought I was doing it right. I did notice in this, I thought was just kind of normal aging, less energy. I had a numbness in my hand a little bit and some shoulder pain. Turns out I had a radiculopathy. MRI of my neck showed a bunch of bulging discs that were depressing, but what was I to do? I had chronic neck pain, which I didn't know what that was from, but I was basically eating ibuprofen at that time. I did have exercise became more and more uncomfortable for me after running. It was actually the neck pain that was bothersome, so I kind of transitioned to golf. And just little things that when I talk to my other people that around me, this is not that uncommon. Some climbing stairs wasn't I didn't love it, and putting on socks in the morning just became a little bit less fun. I had this really weird eyelid problem, which caused some wrinkling. Wasn't a good look. Didn't understand it. It was like an eczema maybe of the eyelids. And then I was my son had palpitations, and he was getting a workup with for his high school soccer. And I mentioned to the pediatric endocrinologist or cardiologist that I got palpitations too, and he's like, "You should been diabetic a long time. You should get that checked out." So I went and I did get it checked out, and those studies were okay. But they said, you've had diabetes for quite a while. Why don't we get a coronary CT scan? So this is to look for calcium in your coronary arteries, and I got that early on March 11th, 2014, at age 42. So you can do the math and figure out how old I am if you want. And I saw this white spot, and I've never seen these images in my surgical practice. So I thought, what is that? That looks like a lymph node, maybe. Hopefully, that's calcium in my coronary artery. So I actually Google imaged, and I saw this is my CAT scan, but I Google image it. The Google image looked just like this. So I was like, oh my God. So I was depressed. I was doing basic science research at that time. I canceled my meetings the rest of the day, and I was like, what am I going to do? I was depressed for maybe an hour. So I think Don and I are similar. We're like, you can beat us, and we might feel bad for a minute, but we're not going to feel bad for very long. I got on to pause. This was a shock to me. I was like, I always maintain normal blood sugar, and I was doing everything right, everything that they don't tell me to do. But it shouldn't have been a surprise. It shouldn't be a surprise if you don't have type 1 diabetes. It's the leading cause of death. It's responsible for 1 in 4 deaths, 1 death every 36 seconds in the United States. We know from traumatically killed children that by age 10, all kids by age 10 have the startings of coronary artery disease. It is unbelievable. So these two bolded are the ones that I tell the residents to try to give them a little kick. That by age 10, if you've been eating a standard American diet, you have the start of coronary artery disease. And if you say, well, I'll just wait, my cholesterol is fine, whatever, if you wait, unfortunately, the first symptom in a lot of people, up to some people say that, depending on how you interpret the studies and the data, it's between 25 and 50%. The first symptom will be sudden death. So that doesn't give you another opportunity to adjust your lifestyle. So if you don't have diabetes, type 1 or type 2, I'm here to, these facts will motivate you today. But add to that, if you have type 1 diabetes, you're at 3 to 11 times the risk as the general population. So if this wasn't bad already, this is much worse. And, I feel like this issue was never discussed. It's all about glucose management and and that is really important. That is really important. But when you're talking about eating a diet and eating a lot of animal products or fat and high protein, because you have to get your calories somewhere. So if you're eating low carb, you have to be getting your calories from fat and protein by default. Those are the only 3 macronutrients that give us calories. So if you're doing that, we know those increase your risk for heart disease. So I don't think that was so. In that depression, I searched the internet for how to. I searched reversing coronary artery disease or something like that, and I read this. I actually bought it. I found this book on the internet. I bought it on my phone with Apple Books, and this is what the book says. It's Caldwell Esselstyn. He's a general surgeon at Cleveland Clinic. He's now retired from that job, but these are the rules. So no meat of any kind, basically no animal products. So no meat, no dairy, no oil, and then a low fat a vegan diet, basically. So no nuts, no avocados, and then all of this you can eat is you just go for it. Vegetables, legumes like beans and peas and etc., whole grains and fruits. So this was by 11, and he has a lot. I think it's just a chapter in the book, Moderation Kills, and I believe this as well now. So after that gave me hope, and by 11:30 that day, I used to go out to lunch on these days. By 11:30 that day, I was done with animal products. Never got to have my last Big Mac or French fry meal or whatever, which we used to do, with a young family, swing through the drive-thru on the way home, and this is supported in the science. So he's done studies. This was published after I read the book, but he had talked about these patients in the book, 198 patients, and compared the group that was adherent to the diet and those that were not. And basically, the diet was as close to you can get as a cure as possible. He talks about heart disease as a paper tiger. It's nothing you need to be afraid of. There are cultures, there's a lot of books and studies that support this, but cultures that don't have coronary artery disease and that do things that we wouldn't consider necessarily healthy, but they don't eat the animal products, and they have eat a low fat whole food plant-based diet. And what we recommend typically is the DASH diet, the Mediterranean diet. And if you look at those, I don't have a slide showing those numbers. You will significantly reduce your risk of dying of a heart attack or stroke with these, but I would say it's a modest improvement. It's significant, and if this is what you can do, you should do. But it's night and day compared to a whole food plant-based diet. So this is what the diet looks like. This is from PCRM, Physicians Committee for Responsible Medicine. It's a little different than the My Plate that the federal government puts out with the milk up here, but fruits, grains, legumes, and vegetables. And this isn't the way. It took me a while for me to adapt. So for the first month, maybe it's hard for me to remember. I appreciate Don's slide about the time course of when you start to feel better and when the weight comes off. All that stuff happened for me, but it took me a while to figure out what to eat. I remember, I don't have a picture of beans and rice here, but I remember being very hungry, and it took me a while to like, oh, beans and rice, those are okay. So then I finally got full, and it's very easy to get full. Now I eat about 4,000 calories a day. It's not difficult at all for me. This is a 3-pound breakfast right here. I weighed it once just to see. So this is my experience. I want to break it down into the subjective and the objective. So subjectively, I had a dramatic increase in energy. I'd actually cut back on my caffeine. I didn't really even, the chronic neck and back pain was just kind of always in the background, and I knew where the ibuprofen was in the OR areas. I knew where it was in the clinics. I knew where it was where our secretaries sit, and I just stopped reaching for it. I know it took me a while. I'm like, when did I stop taking that? But I stopped taking it. I no longer had the palpitations. That eyelid thing went away, thank goodness. And then I enjoyed exploring new foods. I was the kind of guy that didn't know where the dishes went in the kitchen. And at the time, with a family and 4 young kids, my wife was like, I don't know, I can't do this, Brian. So the family didn't come on board for over a year later. So I did all my own grocery shopping, meal prep, packing my lunch, and I loved it. It was just super fun for me. I also felt good about not eating animals and animal products. And I tell their people, like, how do you feel? Like, I'd go to the doctor, how you feeling, Brian? I'm like, I feel invincible. Like, I really did feel that way. It sounds crazy. Sounds like I'm trying to sell you something, like, buy this and you'll feel invincible. Just give me this much money. But I really did feel that way. And I don't feel as invincible now, but I still do feel invincible. I just, it's become normalized for me now, I would say. I did lose about 10 pounds, but I did lose a layer of fat from my body, so my face, I think, looked different, and people, thought I lost a lot more weight than I did, but I didn't actually, and they, people aren't shy about making comments sometimes, but but the athleticism and exercise tolerance. So I mentioned how difficult, and then I think this is where I talk about it. But so I couldn't. I had so much energy. I started doing the elliptical, and one day I'm like, I'm just gonna get on the treadmill and run. I used to go, on my work days just to the gym and exercise, and then once I got on the treadmill and started running, I'm like, I can do this now. I didn't have pain afterward. That was wonderful for me. It took me about a year or two later to permanently hang up the golf clubs. But this is for those that maybe even the majority of you here are medically inclined. But this was kind of the regimen, and this was before my diet change. I would take a basal this much insulin per day as a long-acting, and then I would give 1 unit of insulin for every 15 grams of carbs. So I carb counted back then, and still do to a degree now. So I was taking about 50 units of insulin and eating about, somewhere around 200 grams of carbohydrates a day. My A1C was good as a type 1 diabetic. This is the good range. And so in terms of total insulin per day to carbohydrate consumption was about 0.25. If I got a little high, I could give myself 1 unit of insulin, and I'd drop around 30 points. But after the diet changed, my basal insulin went down significantly. This is what I take now. I'm on a different insulin, but I split it 9 and 9 units. I take 1 unit of insulin for about 80 grams of carbohydrates. So 1 unit used to give me I used to eat 15, and now I'll take 2 units of insulin for 150 gram meal, which is crazy when you talk to endocrinologists. So my carbohydrate consumption went up dramatically, and my total insulin went as about half. So if you look at the ratio of total insulin to carbohydrate was 0.25, now it's 0.04, so a significant drop. And if my blood sugar gets a little high now, I have to, I can do it. It took some practice, but I can measure to the 0.1 unit of insulin with syringes. I have to take off my glasses now to see. The bifocals aren't strong enough to actually see that well. So insulin sliding scales for someone like me are dangerous, because this is kind of they assume that this much insulin is going to drop you, and this is for type 1 diabetics, even children. This over here is considered normal, but this really is normal. Like this is a type 1 diabetic. This is normal. This is like normal insulin usages. But this is an insulin resistant. So this is what some people will call double diabetes. And I would say everyone in America or on a Western diet has type 2 diabetes in the sense that they have some insulin resistance. So this is supported by the science. So what made me so insulin sensitive, or what was making me insulin resistant before? It's the fat, and primarily the saturated fat in the diet. So like I said, I think all Americans are insulin resistant, and this is based on how these aren't killing any people. The standard insulin regimens and the hospital sliding scales would kill me now. Which is scary for me. I'm always worried I'm going to get in a heart attack. I'm going to put a tattoo with my insulin regimen on. I'm seriously thinking about it. But we know this from studies now, both basic science and clinical studies, that dietary fat acutely increases glucose concentrations and insulin requirements. You know, we're taught from our education that you don't count fat, you don't count protein. etc. But this was a study looking at just one fatty meal, one meal. So this is never mind the baseline of the fat they're taking 3 meals a day, but one fatty meal caused more hyperglycemia despite even taking more insulin. So this fatty meal caused worse glucose control and hyperglycemia. And unfortunately, protein is similar. So, we're so focused on protein in this country, but even the protein is additive to the problem of a high-fat diet. So both dietary protein and fat increase postprandial glucose excursions in type 1 diabetes, and the effect is additive. We're so focused on protein in this country, we don't, protein is a marketing tool. The hospital has 0 patients with protein deficiency. I've never seen a patient with protein deficiency. Almost all Americans, 98+% of Americans, are fiber deficient, including most vegans. This is a horrible slide, and I'm not expected to read it, but this is just a list of the references. And I have more if anyone wants more information. I'm going to show a slide with my email address at the end. You can take a picture and you can reach me that way. And I'll also be around this afternoon. I have to step away from lunch and probably be a little bit late getting back, but I'll be around the rest of the afternoon and then a little bit late to the gala tonight. So grab me. I don't mind stepping out and talking to people if you have questions or thoughts or anything. So this has also been studied in a clinical trial, effect of a low-fat vegan diet on body weight, insulin sensitivity, postprandial metabolism, and the lipid levels. This is how the fat actually, we know mechanistically how the fat causes hyperglycemia or insulin resistance. So it's basically because the fat, it gets inside the cells, the muscle and liver cells, and interferes with the function of the insulin receptor and the insulin receptor pathway. That's a little bit sciencey, but we know that. And in this study, they were able to measure that in actual patients and show the improved glycemic control, body weight losses, as well as changes in the hepatocellular and intramyocellular fat. Great study. So I mentioned earlier that I was able to exercise without pain. So I was never a runner. Running was punishment. As a basketball player, you do something bad, you have to run lines, or they call them suicides now for some reason. But I know when I was in the Navy, we had to do a 1.5-mile test, and this was shortly after my basketball quote-unquote career ended. And I wanted to do well. I was really motivated, so I went all out, and I ran a mile and a half at a 5:59 pace. So that's a pretty good benchmark of where I was at age 25. This was a year before I got type 1 diabetes. And then fast forward however many years, 22 years after type 1 diabetes, I'm able to run a 5K at a much faster pace. So this is objectively more fit and faster. I just did my 9th marathon on Monday, so not even a week ago. Boston Marathon. That wasn't. I don't want to talk about it too much, but it was the only one that wasn't a Boston qualifying time, so it was a tough day for me. But 3 Boston marathons. My biggest running goal or achievement was being the national champion at the 10-mile distance for the USA Track and Field National Championship. I did transition I do iron triathlons now. I like this distance. I haven't done a full one yet. I recover fast and train hard. I train with other people and a lot of athletes with no chronic disease, and I'm able to. They're always asking me like, "What are you doing, Brian? What are you doing?" So I have a lot of athletes in town that eat a whole food plant-based diet now, just because they see I'm an old man and I'm beating them. But I'm not alone. This was the Wimbledon final. Both of these are plant-based athletes, and these are all athletes at the top of their fields. So not all of them are completely vegan. I think Tom Brady is not completely vegan, and now he's kind of retired. But all these guys, Justin Fields, an up and coming quarterback. A lot of NBA athletes are. These are just three names you might know. The tennis, Lewis Hamilton, F1, and there's many more. To learn more, if you haven't watched this documentary, I highly recommend it. It's on Netflix now. And these next few slides are just when I talk to usually other physicians, but I do think type 1 diabetes gives a window into, metabolism and macronutrient effect. You can do this in non-diabetics too, and people are, CGMs are getting more popular for the lay population, but I have a little bit of concerns about that because they're insulin resistant at baseline, so when they eat a banana, they're going to get a bump in their blood sugar, whereas when I eat a banana and doesn't hit me doesn't touch me very much at all, because I don't have insulin resistance, so it gives a window. There are other things to managing type 1, and if there's any type 1s, just grab me at some point and we can talk about more. But there's more to type 1 diabetes than just eating this way. So if you don't follow a whole food plant-based diet, I encourage you to try it. You can read papers and watch videos and documentaries, but it won't be convincing to you until you actually do it for yourself, and that will speak way more powerfully than the evidence. As a physician or a provider, it's just, we know from the doctor smoking and advertising that it's really hard to counsel patients to not do this, not do that, eat this way. If you're still smoking, you're not going to tell your patients not to smoke. It just doesn't feel right as a human being. And then empower your patients. So that was kind of the biggest thing for me, is I felt like I had something I could do. I had type 1 diabetes. I can't change that. I'm managing my blood sugar as best I can. I can't really improve on that, although the diet change did help me. But your patients they're not victims. They do not need to commit to a life of suffering, of medications, of in and out of the hospital, of worrying about their blood sugar, of worrying about losing their legs. All of these are touched and can be affected with the power of a healthy diet. And don't assume because they're a farmer that they're not going to change their diet. I have a few, and give them the benefit of the doubt. Who actually does it may surprise you. I don't know. Where am I for time? Am I at the time? Yeah. All right. So I'm going to end there. I did want to talk about the why, and Don touched on this earlier. It's really important. I'm just going to go to the end. There are a couple ways to do it. One day at a time, one meal at a time. These are great for transition. I think I love this because it gets rid of the decision making. You don't have to think about which day or what, tomorrow. It's just psychologically, I think going in 100% is easier and reinforcing. So when you eat, when you feel great, you're not going to want to change. Living this lifestyle and eating this way is much better than a life of worry and concern. I love this book because it gives a very nuts and bolts, very practical information. So it's a very popular book now. It's my family, and that's my email address. So thank you very much. I'm sorry. I'm over.